Okay, it is the end of April in Fort Myers, Florida, 2019. We have a great patient here from Ontario, a famous plastic maker for automobile parts. And you had an interesting situation. You had LASIK many years ago. How myopic were you? Minus, do you recall?
Minus very.
minus a lot.
Quite a bit.
But you had these vitreous clumps. There's one. You see it over there? It's. And what were your symptoms with that in both eyes?
Both eyes were very significant. I do a lot of work on the computer, a lot of work where you're judging and looking at things where it has to be within thousandths of an inch, which is less than a hair. And I used to be very good at it, but it progressively got worse, and it got to the point where you weren't trusting your eyes as much as now you were trusting more your instruments.
Right. So anyway, this was they look small, but when your pupil is small, the light can't get around it, and when it's behind the natural lens of the eye, the light can't get through, and you had to shake your head to get it out of the way.
Yeah, it got to the point where even just looking at a menu on a TV, I couldn't read because of the dark lines, and the pieces would get in and cover over letters and numbers and things, so I was unable to, and I'd be constantly looking right and then having to try and come back slowly to keep them out of the way.
Right, and anyway, a lot of ophthalmologists just don't understand because they look at your vision, you're maybe 20/20, and it's an intermittent phenomenon, but it can be disabling in both eyes or very, very annoying. There's a big one right there. Let's show what that is. I can. But anyway, to make a long story short, Dr. Scott Geller did. How do you find me, by the way? On the internet?
Yes, definitely.
Yeah.
I did the research.
Okay, I've probably done more of these than anybody. I like doing this. It's fun for me, and it's fun seeing a happy patient. But we've done basically 4 laser sessions on each eye. It looked a lot clearer with the last session. I was happy with the result. There'll always be something to see, but the goal of laser is to make things better. We can't turn back the clock 100%, but we can improve the quality of life and vision. And if you had one good eye, this would have been very disabling. We see a lot of one-eyed patients. So anyway, you're here in Florida, back to chilly Ontario in a day or two.
I'm very happy with the results. My vision on an everyday basis seems almost perfect. Being as picky as I am, I'm the kind of guy that looks up at the whiteboard to find them, as opposed to realizing that in an everyday atmosphere they're not there anymore, as opposed, you know what I mean?
Yeah. Well, there'll still be some stuff, and darker walls are better than than white walls, and incandescent lights are better than fluorescent lights. For this, pupil diameter has a lot to do with the perception of floaters. Anyway, you're a great patient. I love doing this. I love having a happy patient.
Thank you.
And
Appreciate it.
take the word back to your colleagues in Canada.
I will. Thanks.